Leo Cans from the Médecins Sans Frontières, Doctors Without Borders, because Hamas health authorities have said that 25 ambulances have been struck in this war so far. Health workers also killed, they say. And Leo has a team inside Gaza. You're with Doctors Without Borders. What has it been like for your people in Gaza?
It's been terrible. Until now, it's been terrible because they are working in a very, very difficult condition. One of the main concerns for us is security. As you know, the bombing is very intense on the whole of Gaza Strip, not only the north, even in the south. So we have teams spread in the north and in the south, but the conditions are extremely difficult for them to work.
We're hearing about this fuel shortage and what that means for the hospitals. Have you got an idea? Have you got a number on the hospitals that are having to be shut down because of the fuel shortage? And what can you do with the most vulnerable patients who have been in those hospitals who presumably now need to be moved?
Yeah, fuel shortage, among other shortages, is a big concern. The problem with the fuel, as you know, is like all the electricity has been cut off in the Gaza Strip. So all hospitals currently are working only on generators. And the fuel stock are getting lower and lower every day. We've been talking about this for one week now. Until now, they managed to overcome the rupture of fuel by finding other stock in other places in the Gaza Strip and by rationalizing the use of the fuel. Also, some services has been closed in order to prioritize life-saving services. But what it means, specifically, concretely, it means that already healthcare is not working in the Gaza Strip for a whole part of the population that do not have any more access to healthcare. And part of this is because of the fuel, because the hospitals cannot work completely. Almost 12 hospitals, actually 12 hospitals are now shut down in Gaza at the moment where we would need even more hospitals because the amount of wounded is beyond all the capacity. So all the hospitals has way too many wounded patients and they cannot take care of all of them. So fuel is a big concern, both for hospitals, but as well for water.
And the Hamas health authorities are saying tens of thousands of people have been taking shelter at the hospitals. We've also seen the images for ourselves, families using these places as places of shelter, safety, they hope. But there's an issue there around the spread of disease. These are unsanitary conditions. Is there a realistic way of getting patients to other hospitals?
Exactly. This is an extremely concern. We have, especially in Shifa Hospital, which is the hospital where we have colleagues working now, and the amount of IDPs, internally displaced people in this hospital, is a big concern in terms of hygiene, in terms of medical team working properly. The situation in the hospital now is catastrophic. I can tell you that I receive video and pictures every day from our staff on the ground. It's horrific. It's untenable. Too many children, way too many children are arriving in our OTs. 2 days ago, we had to operate a 10-year-old boy kid on the floor because all the OT were full. So the surgeon has to amputate his midfoot on the floor with half of the sedative dose normally used. It's horrific. And the mother of this child, because they were on the corridor, was watching the scene, and the sister was waiting her turn to be operated as well. So it's horrific scenes we see every day in the hospitals. There is no justification for this. We have too many operations currently ongoing without the proper dose of anesthetic because we are lacking morphines, we are lacking sedatives. So we have to. The surgeon has no choice but to decrease the dose, and in some cases they just do it without dose, without anesthetic, including for children. There is no justification for this. So we are really calling for an opening of the border and free access for the population to the medical care. For MSF, we have the supply. We have the HR people. We have people ready to go inside Gaza to relieve the teams. We have equipment, material equipment, medicines, consumables. We have everything. We are ready. We must let us go inside and access to the population. There is no justification for that. Too many children are being victims of this war, and too many civilians are arriving in our hospitals.
Leo Cans from Doctors Without Borders, thank you for your time, just describing a truly horrific situation inside Gaza.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.